All right. Okay, so we're now recording and welcome to our provider info share. This is our monthly session for updates and info sharing regarding our provider community. All provider types are welcome, including care coordinators. And we have a great agenda to share with you. Just a couple things before we start. The meeting is being recorded, so we'll have it on our training YouTube channel. Um, for that reason, it's good to know not to share private health information during the session. Um, we can answer general questions that are of interest to most provider types or many provider types, but for specific questions about your situation or case specific questions about a person or a case or a situation, we might refer you to another time or to email us separately, and we'll set up a way to get that information to you. And we have in your chat area, you can interact by chat. You can also interact by speaking if you unmute yourself, and you can share your video by sharing your camera. If you want to do that, this is a Zoom session, so most of us know how to do that. And um, what else? What else? We have we'll have lots of time for Q&A, it looks like. And you can pick up the documents in the chat, the agenda for today, and the FAQs, which is something that we wanted to talk about and remind. Okay, great.
Yeah.
So we can go ahead and get started. Delay, did you want to talk about the end of PHE and FAQs?
Sure.
Okay.
Yeah. So I think the biggest thing that we've been bringing this topic up for months now, and I know that we're kind of like a broken record about referring you back to that FAQ list, but we really want to make sure that every agency is going to have be impacted differently, and have different situations happen just because of your different caseloads and like the services you offer. And so it's difficult for us to kind of go through and explain how each one is going to impact you. It'll really depend on the situations that you have. So we really want to encourage you to go through that frequently asked question and explore if some of those situations are going to impact your cases. And so that could include like maybe during the pandemic, you had legally responsible individuals that offering day hab, and that's not allowed. Or maybe you had that's not going to be allowed as of that end of June 30th is the last day something like that is allowed. And starting on July 1st, somebody else will have to be offering that service unless you have a court like guardianship decree saying it's allowed. So it's, as you can see, it's like complicated. So take time as providers to go through that document and consider what could impact you. That like LRI piece is just one small snippet of the many different pieces that could impact you, the many different elements of distance delivery, of regulations that are going into effect. And so it's just a lot of moving parts. And it is complicated because some things have transitioned over the course of the pandemic and became permanent or stopped along the way. So if you feel confused about any of this, no, you're not alone. It's completely understandable to have a hard time tracking what's in effect and what isn't, what stops and starts on July 1st. So please reach out to us and reach out to the policy team and ask questions, and consider how it could impact your agency because it is uh, we don't want this transition to impact families in a negative way, and that means that we have to give a lot of messaging and time and energy and kind of identifying how that would impact. Anything to add, teams, or any questions about the end of the public health emergency?
Um, Anybody in our group want to ask a question right now? And anybody attending or staff? Some of us are still, I think, just connecting.
It's okay.
I
It
don't have
could,
anything.
yeah, you might have something come up in the future, or just take that time to think about how it could impact your families, the people you work with.
Hmm. Yeah, the FAQ document is pretty comprehensive. It does answer a lot of the main questions about legally responsible individuals providing services, which ones are allowed ongoing, which ones are ending June 30th, as you said, what to do if people have questions about guardianship. That is in there too. There's info in there about people who have been receiving additional respite and rehabilitation due to COVID-related factors. Um, that will not be extended past June 30th. Rehabilitation will be reviewed according to its latest regulation, which applies limits, of course, in the amount of rehabilitation, and then specifics to request additional, not related to COVID-related reasons. We do have separate training available in our learning management system in our academy about the new rehabilitation regulations. If anybody wants to participate in that, you actually just engage in that training online in our academy. Um, Additional respite is available. There is uh, instructions, if you will, in our, or at least it describes conditions to request that in our regular regulation. It's just not available due to COVID related reasons only. It's very specific to the person and their resources for needing respite, their main caregiver needing a break and things like that. But anyway, a couple of things have been made permanent. A certain percentage of distance delivery for rehabilitation, employment services, and intensive active treatment is available over distance delivery, which is a computer-based or an online-based platform, an encrypted platform with a video component to provide those services. Care coordination is all changed. I don't want to go over all that unless people have specific questions. But monthly contacts are different. I guess as a provider group, that maybe it's worth it to mention that care coordination is at a minimum now 2 contacts per plan year, or every 6 months, an in-person contact. And then outside of that, phone contacts with providers and legally responsible individuals. So it's less in-person contacts for care coordinator visits. There's if anyone is an employment services provider, it explains the requirement for training for employment services admins.
Info share.
And
Just so
see
everyone knows, I think a
Go ahead.
couple of you aren't muted, so I'm going to go ahead and ask to mute for a few of you. Thank you. Go ahead, Kara.
Okay. Yeah. Yeah. So, I mean, knowing those things, do folks have questions? Do you have anything from your standpoint as a provider that we can clarify for you around the flexibilities ending, maybe those that have been made permanent and what that looks like? I feel like we have talked about it a lot, but I think we can never talk about it enough, really. So, what are your thoughts, everybody here today?
And it's okay if you don't know what you need to ask right now.
Okay.
Just take some time with it. I know we're all very busy and it's summertime, so Alaska's energy, you got to go, you got to get things done. But please take a few minutes to just go over this content and think about how it could impact some of your cases that, well, some of the families that you work with. So just kind of consider that as, um, and if you have questions or if families have questions, you can always bring them to training and we can work from there and help figure out a path forward. So what's next on our agenda? The next item is about CFC PCS. Now, there is a little bit of tricky timing when it comes to applying for CFC PCS. The ultimate question that we keep getting and keep having issues around is, when should a PCS agency file an inquiry for a CFC client? When is the appropriate time? The answer is after the care coordinator submits their application. What happens if you submit it too early? The inquiry from the PCS agency will get denied. What happens if you file it much later? And that does happen, because just trying to find an agency later on, it may not happen in lockstep with that application process. It's okay. But what can happen is that the notices that kind of automatically fire based on situations can get really confusing if it appears that there isn't an approved, or excuse me, a um, like an agreed upon PCS agency that's agreed to provide services. So best option is, as care coordinators, work with those agencies and let them know when you submit the application. They need to know when you put in the application so that they can put in their inquiry. PCS agencies, wait to submit until you're told that they've turned in the application. You might have to check in to make sure that you're all on the same team. It's just part of working in planning teams, is to collaborate and communicate with what's going on. What if you have a situation where the PCS agency agrees to deliver PCS CFC later? There might be some unusual notices going to families indicating closures, and it can be confusing. So as providers, take a look at those notices and evaluate what they're saying. If they say, you're getting this closure notice because you don't have a PCS agency and you just filed your inquiry and it was approved, you know that it was one of those situations where, like, the paper, two ships passing in the night, the paper goes in, the paper comes out, and some automatic processes happen as things go along the way. We're looking at ways that we can make some of those notices a little less intimidating and a little bit clearer to understand, because it's just part of that process of timing and how to get things to operate. So thank you for the question, Heidi. Is there a way for renewal NFLOC to allow VODs within the past year? We're really struggling with getting VODs sent back, and they're hitting the 120-day mark for renewals. The timing's not great. Thank you for that. I do believe there has been work in kind of exploring what we can do about VODs and how we could align them more with IDD approaches, like NFLOC and IDD. And at this time, it's not something that our division can adjust. They explored it, and it wasn't something that they could adjust at this time. That doesn't mean we can't take that information back again and just let them know that it is a continued question. When we're having difficulty in getting the VODs, there are some things that you can utilize as tools. One of them is that there is a director's memo that, I might be speaking here. I think that's about medical records.
The memo is about medical records and getting them timely from providers and not having to pay for them.
Got it. Yeah, I paused halfway through that thought. You guys, this is a live session, so sometimes we start walking down the track and have to pause. Thanks, Kat. I think what factoring in here is that usually our doctors are Medicaid providers, and if you are having continuous problems in getting a VOD from different providers, you can file a quality assurance report. That is something that you can do. I understand that sometimes people hesitate to do that because they don't want to, they don't want to rock the boat, so to speak, but it is important that we get those VODs. We do need those VODs in those timeframes. That being said, we can take back the feedback. It's still continuing to be an issue with the timing. And I know, Kat, you've heard that a couple of times. Yes. Okay. Any other thoughts about PCS CFC inquiries or about VODs? All right, so we'll move on to our next agenda item. And if you're still in the process of writing your thoughts down, we can always circle back, okay? So don't feel like I'm skipping if you're typing away. It's okay. We can go back to your thoughts. We do have a opportunity coming up where we are going to have some time with provider enrollment, and we'll be able to have them available to talk at the Care Coordinator Info Share in July. And that will be a recorded session that all providers can view. We are hoping to find out if any of you have questions specifically about provider enrollment. If you do, you're welcome to drop them in the chat, or you can email them to sdstraining@alaska.gov. The intention of this session, it's not really a town hall listening session. It's really intended to be an educational experience for you. So that's why we're doing this pre-work of trying to collect questions so that we can really come up with some structured content and working with our contacts at provider enrollment so that we can iron out some of the wrinkles that are in the process that providers have been experiencing. So please feel free to send us your questions or type them in here.
So the Gainwell staff are going to come to the Care Coordinator one, the Care Coordinator Info Share. When we talked with them, they indicated that they wanted to do more outreach in general to providers. So I just wanted to, throw it out there that it's not only for care coordinators ultimately, and it's more just about how we've structured our outreach meetings. So after we do that session, then, stay tuned for more opportunities to engage with Gainwell in different ways. It's a learning process it's about finding out the provider experience with enrollment, and so that they can make some changes to their system, hopefully to have it go smoother. So.
All right, we have our usual reminders here regarding individual and family quarterly info sharing. So we have that link available. The link for this series, if you'd share it with your partners throughout your community and throughout the state, feel free to do that. We also have our office hour resources, which again is a great space for you to come visit if you're wanting the immediate answer or like if you need help, come to an office hour and we'll try to track it down for you. It's also a great opportunity to touch base with us. If you have any of those PHE questions, provider enrollment questions, harmony questions, or just you need a environment to kind of pick the brains of state of Alaska people. So please feel free to stop in. We also have our YouTube training channel and our policy channel, as well as the Academy. I really encourage you all to take time to take time to take the DAHAB training, because the changes that are going into effect on July 1st are covered within that training. So it's the new approach for dehabilitation. So with that, we can open the floor for any questions or feedback that you might have. And then if it's, we're good to go, we're good to go, and you can log out if you wish.
All right, looks like a small group. People are dropping. All right, that's okay. So what we'll do is we'll grab this recording, put it on our YouTube, and we'll send you these documents after, of course, we're done here, and after we get our YouTube posting done, so we can get a link for you. This is not a CEH session for care coordinators. It's just an open outreach session. But you can share it with folks who couldn't come and who couldn't attend. And I think we'll just call it good. We'll call it a meeting. Okay.
Thank you.
All right.
Thank you.
Thanks, everybody. Thanks for coming.
Thank you.
Bye-bye.
Have a great weekend.